COVID-19 restrictions are preventing some hospice patients from being able to see their families and friends in person before they die. News on 6's Sawyer Bussey tells us how nurses are making a difference.
Hospice nurses say they're doing everything they can to continue comforting their patients who are dying without loved ones by their side.
This is the first mask that we put on.
End-of-life care can look a little different right now because of COVID-19. Nurses at Grace Hospice are wearing PPE while treating patients, whether that person is dying from COVID-19 or not.
It's a calling, and when you're called to do this, you exceed at it.
Nurses say human touch and sound are incredibly important for someone who's dying. So even though the nurses are wearing protective gear, they try to keep the experience human and genuine.
Hearing is the last thing to go. And so being able to give them those blessings and family saying goodbye and that they're going to be okay.
Whether a person is dying at home, in a hospital, or nursing home, every place has its own rules, which means some people are dying in facilities where family and friends are not allowed inside. Dr. Michael Gorman says these restrictions make the jobs of hospice workers even more crucial.
We're able to actually be there by their side and hold their hands, and we just are available and will be there.
A lot of times what we've been doing is using FaceTime so that they can see their loved one and say goodbye and say their piece.
A hospice worker's job is not just to be there and help someone who's passing be comfortable, but also to explain what's happening to their loved ones, whether they're in the same room or on the phone.
Dying's not easy. It's a privilege to be welcomed into the homes of these patients and their families, and they become our family.
Sawyer Bussey, Oklahoma's Own, News on 6.